every single person knows someone that's been affected by cancer. At the same time, I feel very excited and passionate about trying to develop new technologies that can help these patients. I'm sure everyone here in this room knows someone in your family or a friend or even yourself that's gone through the painful diagnosis of cancer. Now, if you know someone has had cancer, likely the main treatment option for this patient has been surgery. Cancer is a very complex disease that can happen in a multitude of organs in our body. The main goal is to remove that diseased tissue. If you take too much of the normal tissue that is functional, that is healthy, you could be really lowering their quality of life by affecting everyday functions that you may need to perform with these organs. So when I started doing research in cancer, I had this perception that it was really easy to identify visually if a tissue was cancerous or normal. And it wasn't until I really started to work with clinical specimens that I realized that cancer tissue looks a lot like normal tissue. It can be very challenging, even for incredible surgeons, to recognize the boundaries between what's truly diseased and what's truly normal. A very clear example of that is brain cancer surgery. You really want to remove most of the tumor, the majority of the tumor, but you want to preserve all of this incredibly functional normal tissue that is around it that might not be affected by the cancer. So the technology that surgeons have been using to address this or to verify surgical margins during surgery, it's called frozen section analysis. So the technique that is used nowadays to identify this boundary of cancer tissue and normal tissue during surgery is the same technique that's been used for the last 100 years, which is histology of the tissue. So the way that this is done in clinic is during the surgery, the surgeon will remove the bulk of the tissue, and then that piece of tissue is put on a dish, and a staff person in the clinic will walk this tissue to an adjacent room. They quickly freeze the tissue, section the tissue, and then they stain with some common dyes. And a pathologist will look under a microscope and try to identify if there was still cancer or not. And during this processing of the tissue, the surgeon is still waiting in the operating room for a response if the tissue still has cancer at the margins or not. So besides being a lengthy process, it can also be inaccurate. This quick processing of the tissue can generate artifacts that can make it difficult for the pathologist to identify these tissues. Now imagine if there was a way that we could actually give the ability to a surgeon to do this analysis in real time in the operating room and help provide this better treatment option for the patients. What we invented here in my lab and with my team is what we call the mass spec pen. The mass spec pen is a handheld device that, through a very basic chemical analysis, can identify if a tissue is cancerous or normal by simply touching it to a tissue. So our vision is that with this pen, less tissue is going to be removed from the patient so that we know with certainty that only cancer is being removed, but that normal tissue that's part of our functional bodies can be preserved and really improve quality of life for the patient. This is a piece of human tissue. This is ovarian cancer. So the way that it works is the mass spec pen at the tip has a tiny reservoir where through tubing systems we fill that reservoir with a single water droplet. And then once it is touched on the tissue, it interacts with the tissue to extract molecules that are soluble in water. So this is the mass spectrometer that we currently use. That's the analytical instrumentation that once the droplet goes in, will measure the composition of the droplet. And every single number is a mass that represents a specific molecule. Based on the analysis of the mass of these molecules, now we can determine if that droplet was analyzing a tissue that is normal or a tissue that was cancer. The entire process from touching the tissue to getting that feedback is within 10 seconds. So that is the easiest way possible to just sample the tissue, get all of these complex analysis done so that the outcome is a very simple diagnosis.
When you apply the path pen to tissue, it rapidly identifies whether a cell is healthy or cancerous.
We have been testing our technology and human surgeries. We wanted to make sure that you could do this analysis, and if the tissue is cancer, then you remove it. But if the tissue is normal, you just preserve it in the patient without having to take it out. My dream would be that almost every single operating room would be equipped with our technology, and that we would be helping surgeons remove cancer in the very first procedure and give that patient the certainty of a cancer-free life after such a difficult diagnosis.